So updates. I just now got the okay to take the test. They opened up the um, availability portal to complete this and to complete the quiz, which is a 38 question quiz, and I passed. I barely passed, which is very disappointing to me. There were a few questions that were a lot more simple. There was probably maybe two questions that out of the whole thing that were like I probably wasn't going to get. But other than that, I could make some readjustments to hopefully get that right the next time. I can go over the questions I went wrong, and I can do that right now. See if it'll let me get through this. And missions. Let's see. Okay, here we go. So I passed it by one question. If I would have got two questions wrong, I would have failed. And I only get one attempt. I got really lucky on Father's Day, okay? So, show you what kind of questions I got wrong. It says, which of the following statements is true, and how a nursing assistant should assist a resident with one-sided weakness after a stroke. There's four options. I'm going to say NA, which is nursing assistant. The NA should lead with the weaker side, which is what I picked. But the correct answer was the NA should stand on the weaker side. And the reason I chose the lead with the weaker side was because I know that I thought of like when you're dressing somebody and you're putting their clothes on, you want to start with the weaker limb. Like if their arm is totally limp, you want to start with that limb and then put the clothes on. If there are stronger on a limb, you want to lead with that one. That's why lead with the weaker side. That wasn't a good choice. But the answer says I should stand on the weaker side. So that was the correct answer. So that's kind of what I thought with that one. Okay, so the other question 11, which of the following statements is true of congestive heart failure? I chose my answer to the nursing assistant will administrate nitroglycerin to relieve painful episodes. The reason I thought it was nitroglycerin because it has to do something with the heart, or at least I thought I remember it did. But I know that, if you have congestive heart failure, you just don't give, I don't think there's any medication they give for heart pain. But I chose because I thought it was the medication nitroglycerin because it had to do, I think, with the CPR. Nitroglycerin, I think, has something to do with like a CPR that medication can be administered, which is sort of correlated with the heart. But the correct answer is residents may take medication that makes them urinate more often. That I did not know. That I wasn't going to get. So there is a medication that makes them urinate more often when they have congestive heart failure, which, I don't want to get into higher, deeper medical terms of what maybe I think that is just because, the more fluid you have in your blood, which is why they always tell you to drink water, the easier it is for the fluid to pump in the heart and blood vessels. So it has a good smooth. It's not, it's kind of like a tire that's not inflated very well. It's very inflated. It has good circulation. So the other question I got wrong was, how is glaucoma often treated? I know it was an eye thing, and it says with eye drops is the correct answer. But I put artificial eye transplant because I couldn't remember what it was. I know I was trying to think of the different parts of the eyes, and I couldn't remember what it was. I know it wasn't any of the other ones, but I put with eyeglasses or by reducing the amount of light in the room was kind of sketchy, but with eye drops. That was just probably my inability to come up with that answer. and nursing assistant. I know glaucoma is used for weed. When you have glaucoma, you can actually smoke weed, and it reduces pressure from the eyes, to my understanding. Because people that smoke weed have glaucoma can't have a legal license to smoke weed, and the reason they do that is because it releases, I think, pressure and discomfort in the eye. But anyway, so an NA can respond to sundowning. Sundowning, I've just remembered, and I was like, damn, what was Sunday? Sundown had to do something with like walking or something like that at certain times. So I chose scheduling activities during the day. So the person is sundowning, and they're sort of, to my understanding, sort of doing this walking back and forth, and kind of, and sort of antsy, just because they're just doing that. I would schedule activities during the day to maybe kind of change that energy to maybe doing something activity to kind of help calm that down. But and then I got that wrong. Correct answer is setting a bedtime routine and keeping it. So if somebody's sundowning, you want that to be you setting a strict schedule on the bedtime routine, that they sleep during this time, and keeping with that, so to help with that. And I guess it'll keep them sort of that energy of wanting to be active at a certain moderate time. But I got that wrong. Scheduling activities during the day is what I chose, but it was wrong. It's setting a bedtime routine and keeping it. The other answer I got wrong is when a resident, this is 38 questions total of the test, okay? So when a resident with Alzheimer's preservatives, when a resident with Alzheimer's disease preservatives, the NA should. Preservatives is, to my understanding, Alzheimer's disease preservatives, which is just this AD. It says AD preservatives. To my understanding is where, which is very true, a resident will keep doing the same thing over and over and over again because they're preserving that thought. They're preserving that sort of remembrance of what they used to do and what they did. So that's kind of what that is. And I chose that as, I didn't know that answer, so it says use a Theorasius to find new ways to say things. And I thought, well, maybe if you say things in a new way, it'll kind of channel out of that repetitive behavior or cycle. But no, the correct answer is answer questions each time they ask. Which, if somebody's running through a whole bunch of different types of bunch of different types of cycles of these preservatives, things that they were doing, and you just answer questions each time they ask, they can keep asking you questions, the same question repeatedly, because remember, they have Alzheimer's and they're running the same cycle. So maybe you want to use new ways to say it to give a better understanding. But that's what the answer was. Okay, so I got that wrong. I wasn't going to get this. This one was difficult. When is using activity therapy a good idea for residents with AD, which is Alzheimer's disease? Using activity therapy a good idea? When is it using activity? So get them to be active, doing all kinds of stuff. I don't think there's ever a good time to do it when it's a good idea to do it, because they have it. It doesn't, it fluctuates, so there really isn't a good time to do it. So I don't think there's never really a good time. But the answer was most stages. Most stages of Alzheimer's, using activity therapy is a good idea. So most stages. I can't remember the stages of it. There's various different, obviously the worst memory, but to forgetting simple things, and so on. But to my understanding, what was it? Did I say this earlier? Alzheimer's, when people have Alzheimer's, it creates protein deposits in the brain. and then I think protein deposits, and I think it's like I think it said white blood cells. Was it white blood cells? It was something else. It was some other cell, but it creates, like when people have it for long periods of time, and it can't be fixed. It's not the cause of Alzheimer's, but there are protein deposits in the brain. So at least that's what I remember. So anyway, that was the answer. Most stages. So most stages you can kind of give a good idea for them to be active. When transferring a resident from a bed into a wheelchair, where should the wheelchair be placed? And it says the answer is the stronger side. And on the stronger side, what I chose is on the affected side. So it was tricky for me when transferring a resident from a bed to a wheelchair. Where should the wheelchair be placed? And I'm thinking, on the affected side, because but you want to place it on the stronger side, I guess. When transferring a resident from a bed to a wheelchair, where should the wheelchair be placed? And I'm assuming, I guess, the stronger side is the answer, because it is, assuming that the stronger side of the patient, whether they had a stroke, whether they had, a limb that's missing, or whatever it may be. So that was the answer. You want to put it on the stronger side. So I'm assuming right now that is on the stronger side of the patient. So the patient is open for left and right side, and their left side is weaker. So you want to put it on the right side of the bed, right? So that's the answer. And this right here is question 26. When skin begins to break down, a resident may experience, I put blistering in an affected area. The answer to this is skin that is a different color than the surrounding area, which, and there's a couple of different answers to this that were pretty sketchy on this. They have partial skin loss in the affected area. That could be it. Bone that is protruding in the affected area. That's when it begins to break down. So I got that. I didn't think that through probably, but the correct answer is skin would show some sort of discoloration, which is correct. Yeah. Okay, so it says here, this one, question 28, was never going to get. It says a blank keeps covers from resting on a resident's legs and feet. Bed cradle is the answer. I chose chanterelle. I don't even know what I just remember seeing that word somewhere in there. I was like, I don't know what, is it hand roll or draw sheet? So I chose chanterelle. So that was pretty much the biggest guess. Question 31, I got wrong. Ways to prevent aspiration during oral care of residents who are unconscious include. The answer is using as little liquid as possible when giving oral care, which is, I should have known that, but I chose turning residents on their stomach when giving oral care. And I thought it was weird at first. I was like, well, if you're having them on their stomach, how are you going to brush your teeth? I mean, you would have to be at the very low level, squatting down, and I probably should have chose using as little liquid as possible. But I was thinking just to make sure that the food or any liquid could never go down the throat, because remember they're unconscious. And so that was the answers. So I got, let's see if you have any I got wrong. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I got 10 questions wrong out of 38, which is pretty bad. But I passed. It is a passing grade, which means it's going to be sketchy when I do the exam. It's going to be very sketchy. I don't know how many times I'm assuming you could probably take it several times, a large number of times, but because I'm completing the class and I am going to clinicals. So hopefully, we'll have to wait. So if I fail, and the thing is, it's like $150 to take the exam. It's like a written exam, clinical exam. I don't know. It's like, I think it was like $150 I had to spend on the test. So anyway, 74 out of 100. I got 74%. So I passed, but I barely passed. Barely. I'm still disappointed in that. I'm disappointed. I should have better common sense with that. So, well, better luck next time. I did pass, so I am going to try, hopefully, to do better, and continue taking these quizzes, because I got 2 more quizzes to take. I got a chapter 7, 8, 9, and 10, which is 50 questions. That's going to be difficult. 50 questions, just over 4 chapters. I don't even feel like I'm going to, it's going to be tough. But the final, and I get 2 attempts on here. So the test that I just took right now, I got so lucky that I only get 1 attempt on that one. Only 1. And last week when I took that test, it's 1 out of 2 attempts. I get 2 tries on that. And then final questions, 100 points. Final 60 questions was the final exam. You get 2 chances, is what it says here. Final 60 questions. So I get 60 questions and I get 2 tries. So I don't know what happens if you fail that. And then it says here, I get 50. Why would they put 50 questions in over 4 chapters? It's slightly lower than the final exam. Well, that's what they got here. So I get 2 chances. The next 2 on each of the 2 exams are going to be taken. 50 questions. That's going to be tough. That is going to be tough because I'm going to have to go through all this. The next chapters I got to go through is going to be basic nursing skills. So that's going to be one part, and that's like, a bunch of pages, right? And it's going to be basic nursing. Then nutrition and hydration. So hopefully, I don't know if I'm going to do all that great on that. Hopefully I do. So that's going to be nutrition. The thing is about this is that they have a nutritionist on site. So someone who deals with this nutritionist is going to be dealing with all the food. Remember, they have social workers. They got a budmans, which are like social workers that directly come to the facilities and investigate everything and talk to the residents to make sure that it is properly functional for the long-term care facilities and the residents that are staying at these locations. So, and then the other chapter I'm going to have to go over is rehabilitation and restorative care. And then the other chapter is also be caring for yourself. Okay? So that's the other one. Caring for yourself, that's probably going to be pretty easy. So that seems pretty generic to me. But it's going to be, so it's going to be going through that. The thing is about this situation too, is that they have all these abbreviations. These abbreviations are going to be, I don't know if it's going to be any part of the test. Obviously, you have meds, which is medication. You have congestive heart failure, CHF. If you want to know what as tolerated, it would be abbreviated as ASTOL. Cath, and COPD, chronic obstructive pulmonary. So I'm going to have to hopefully remember those and have the glossary. So I have all these glossaries. So this test is a lot harder than I really thought. But the thing that's kind of sketchy about this is that it seemed like I think it asks these questions because my job is to be the eyes and ears, because the nurse is the brains, right? So the eyes and the ears, and that's why I think it asks these sort of questions, as opposed to I thought would have made me easier. So that's kind of what's going on, and but I passed. I'll take it. I passed. But I'm hoping to do better, because the better I do, the more confident I feel. But there's a lot of chaos that's going on. So, but that's the results.